Hello, I'm plastic surgeon Mantas Sakalauskas, and today I'm gonna react to TikTok videos about plastic surgery. So let's start from the first one.
Unpopular opinions from a facial plastic surgeon. The truth really hurts, and cosmetic surgery is no exception. When I tell people that gua sha and jade rollers won't give them a facelift magically, they get really mad. So mad. But look,
I would say he is talking true, because if patient need facelift, she or he needs facelift. These procedures, other procedures, they will not help with loose tissue.
But look, I'm not going to perpetuate the myth that these devices will somehow magically lift your face, and then, I don't know, I guess your skin just gets cut off on its own. I get it.
Where is the excess of skin would go? This is also the question for me. Where I see this videos they were showing that no incision, facelift, something similar. I think it's nonsense entirely.
Get it. There are a ton of snakes in plastic surgery and people that just want your money, and I'll probably catch heat from people saying I just want.
About the money, I would say it's more marketing thing also, and yes, they want to earn money, so they just tell people that they can help, and nobody wants car, nobody
want to take your money, and that's why I say these devices don't work. But I really wouldn't be a professional if I said they did do that. My job is really just to give you the options and you decide. People buy things that don't work all the time, but that's on them. And while a gua sha might make you feel better, and clearly mental health is more important than physical appearance, I'm not going to say it works when it doesn't.
Yeah, I agree with this doctor, because we cannot lie to patients. It's unethical. Yes, you work that you would earn money, but you cannot to cheat on people and to tell that something will help that it 100% wouldn't help for you. So in my practice, I also, if I see that something very little invasive will not help, I just tell the truth. If you want result, we need to do that. After that, you will have the scars. Yes, we will be hidden. Some of them maybe will be more visible, but you need to know the true how to achieve this result that you desire.
People are always asking me how I became an expert at liposuction, and the true answer is I practiced. I did a lot of liposuction. So when I first started, no, I didn't really know what I was doing. I was like hoping and praying that things would turn out right, and that like I had the knowledge to fix something if it didn't look right or I had a complication. I watched a ton of YouTube videos, I did courses, I talked to friends that already were good at it, and I basically found mentors in that space. But when you're learning something,
I am thinking she's doctor or not, that she's talking about the liposuction now. Nobody knows, because that she did a lot of practice, and during the time she thought how to do it. It's not entirely good practice and idea. We need to learn a lot of years that we can do that. And firstly, we go with a senior surgeon to assist, firstly, to see how it's done. And then in their assistance, guidance, we do that liposuction, maybe slightly on that part. It takes not 1 year until you can do liposuction by yourself. So let's hear a little bit more of this lady.
Something new, especially like a technical skill, you just have to get into it and not be afraid to do it, because that fear is gonna stop you, and then that'll like already be a non-starter. So you just have to dive right in sometimes so that you can also become the expert.
Do you also learn from YouTube, as she mentioned, that she said that?
No. How I said, we learn in general more than 10 years to become the plastic surgeon. And when you become the plastic surgeon, also it don't mean that you know how to do it if you didn't have a practice with a senior surgeon. In my practice, I had this practice from around 7th year of my learning with a senior surgeon. So during 3-4 years, I learned how to do liposuction.
Discomfort after surgery is actually a good thing. Now, I don't mean writhing in pain and agony. That's not a good thing. But what I mean here is just a little bit of discomfort can help you and guide you in your recovery and make sure that you're not going to do anything that's going to put you in harm's way or damage your surgery.
I would say he's right, but in most cases the patients don't feel comfortable because it's normal surgery. After the surgery, yes, all the time you will have pain. Yeah, we can manage it, reduce it, but it will not disappear 1-2 weeks after the surgery. So yeah, this discomfort, it makes people not to do things that can harm the body or results after the surgery. Different doctors, they made their own protocols of reducing the pains. Okay, so I watched the videos. I like that. Some of the videos were a little bit strange. So yeah, what I would recommend, not to trust everybody in social media. You need to know if she or he is specialist in their own field and if we can trust them. Because what I saw from the videos, sometimes there is disinformation and a lot of disinformation. Thanks for watching. If you want more, just ask. Bye.